Okay, students, we are going to take a look at Chapter 4. Chapter 4 is Truth Telling and Confidentiality. Talks about paternalism and deception, confidential truths. There's a classic case file. It goes over applying the major theories, and then we're going to look at one of the readings. We're going to look at the reading on ethical relativism. All right, page 144. They open up by explaining the challenges. It's what you say and how you say it. And they share with us that for many years, doctors did not feel an obligation to tell patients the truth about their illness. They had this idea of non-maleficence, do no harm. And they're like, well, if we tell them how sick they are, they're going to be upset and that harms them. So let's just not tell them how sick they are. And this went on for years. They've given an example here. All right, a woman, 30 years old, with 2 small children, symptoms of headaches, vomiting, memory loss. They discover she has a brain tumor, a malignant, cancerous brain tumor, and will only live for a few more weeks. So the doctor thinks about it. Does he want to tell her she's going to die in a few weeks? And thought, oh, no, I'm not going to tell her the truth. I'm going to just tell her something vague and give her some medicine and just kind of lead her on. Because I know that if I tell her she's going to die in 2 weeks, she'll be upset. And then, so he just kind of tricks her a little bit, and then she dies. Well, this sort of thing really happened. This went on for years, that they wouldn't tell people the truth because they were afraid the truth would upset them. They did a survey in 1961 and found out that 90%, almost all the doctors, would avoid telling patients that they had cancer. But things started to change. In 1979, the opposite was true. Most doctors would tell the patients the truth. So my point is, this went on for years, that they didn't tell patients the truth because they were worried it would upset them. Now, since then, people have said, listen, we need to tell the truth. Informed patients are better patients. If they understand what's going on, how serious their health situation is, then they're more likely to take their medications and do the things that they're supposed to do. Also, when you trick patients, then they don't trust doctors anymore. And not just them, their families aren't going to trust doctors anymore when they realize you've tricked them. And the long-term effect of lying to people and lying to families has a negative effect on society. So people went on to say, listen, it's important to tell the truth, and the important thing to do is think about how you tell the truth. Sensitivity. Give them support. Tell them the truth, but make sure they have the support they need. They say, you don't need to tell, when you're telling them the truth, it doesn't mean you give them a medical school definition, but you need to give them the nature of the illness, the seriousness, the basic facts. This has to do with respect for people's autonomy and their self-determination. They can't make good decisions about their future and medication and treatment if they don't understand what's wrong with them. So we've got to tell the truth and explain it in a way that's appropriate for patients. The chapter goes on to talk about confidentiality and how important that is between doctor and patients. Even the Hippocratic Oath from a couple thousand years ago talked about privacy. Unless patients can trust that a doctor's going to keep things private, they might not even tell the doctor the truth about things. And the thing is, if we break confidentiality, then patients could run into different kinds of trouble. For example, insurance companies might be like, "Oh, we're not gonna protect this person," or employers, bosses might say, "Oh, we're not gonna hire this person if they've got this kind of health problem." And then if things went public, and the whole communities know about it, they could have problems with their personal relationships and in their community. So there's a lot of important reasons to keep people's health private. Now, this goes on to something called duty to warn. There is a famous case from the 1976. So at the University of California in Berkeley, a student went to the university hospital and told his psychotherapist that he planned to kill another student when she came back from her summer trip. They did not warn the student. They did not warn the parents. And then, when the student came back from her summer trip, she was murdered. So the family took the school and all that to court, and they're like, yeah, guess what? When I know there's confidentiality, what person says to their therapist, their psychotherapist, is supposed to be confidential. But if that person is threatening to hurt someone, you put the confidentiality aside and you warn that person. And that was decided through the courts. See, the thing is, when people go to see a therapist, they need to know that what they're telling the therapist is going to be private. But now the courts have said there's going to be exceptions to that. So what happens if you go to see a therapist? They're going to have you sign a piece of paper that talks about confidentiality. They're going to go over it with you. They're going to say, okay, what you say is confidential unless you admit that there's some type of child abuse or elder abuse, or you say you're going to hurt yourself, or you say you're going to hurt somebody else. Those are exceptions to confidentiality. And that sort of thing, that's all been worked out through the courts. So they give examples up here, confidentiality and the duty to warn, famous court cases where people have to, if a patient says something threatening, therapists have a duty to warn people about the danger. Okay, so duty to warn, you need to understand that. Then there's readings that have to do with cultural diversity. Research showed they researched 800 elderly people from different backgrounds, and the result of it was some of them said, yes, I want to know exactly what's wrong with me. And folks from some other cultures, different backgrounds, said, actually, if it's really bad news, don't tell me, but tell my family, because they'll know how to handle it. They'll know what to do. So this article explains about cultural diversity and truth-telling. And let's continue a little more. So you're going to read about that. Every chapter has something called the classic case file. That is a court case that had an impact. And this particular case involves a patient that was HIV positive. They give him by his first name, Carlos. He had a gunshot wound related to gang violence. He confided in his doctor that he was HIV positive. They tested, he was. So now he was going to leave the hospital and go home, but he's going to need a nurse to take care of his wounds, like a visiting nurse to go to his house to help him. However, he didn't have insurance, so he couldn't have the visiting nurse came. So they were considering having his sister, who's 22 years old, do it. But the sister didn't know that he's HIV positive, and if she's treating the wound and touching blood and body fluids, that put her at risk of catching HIV. So this was an ethical dilemma, and you can read about how they decided to handle that. This was discussed. Okay. Then you move on through the chapter and you get to the section called Applying Major Theories. We have learned in class about utilitarianism. Now, when it comes to telling the truth, ACT utilitarians would say truth telling and confidentiality should be case by case. The right thing to do is the one that's the greatest good of all concerned. But a rule utilitarianism said we need to look at rules that are for the greatest good. And a rule that's for the greatest good would be to treat patients with care and sensitivity. Tell them the truth, but do it in a way that's sensitive and will build trust with the patients and their families, things like that. Kantian ethics, we have to respect patient autonomy. We can never just use people or take advantage of them, and we can't lie to people. So by Kantian ethics, we'd say we must respect privacy. Now let's go on to the reading that I wanted to show you. So the reading is pages 182 to 186. So I'd like you to read a section of this reading that has to do with ethical relativism. This section here is called Intolerance and Overtolerance. That's where the reading begins. They give the example of a medical resident. That means the person just graduated from medical school and now they're doing their residency. It's when you're a medical resident, it's like you're still learning and you're being supervised. And the patient was from the Caribbean and had traditional beliefs from the Caribbean that were related to voodoo and wanted to do some type of voodoo herbal type things. And the doctor said, wow, if this patient really believes that, this patient can't be too smart. He was saying some very discriminatory, rude things about the patient because the patient had traditional Caribbean beliefs. Meanwhile, this doctor had his own traditional beliefs related to his religion. He was he was Jewish with very strict beliefs. For example, on the Sabbath, he wouldn't work, drive a car, or handle money. So what we saw was discrimination. His traditional beliefs were okay, but he thought someone else's traditional beliefs were foolish. So this article talks about having understanding and open mind about beliefs that are different from your own. The article goes on. Let's see. There's another section, belief system of a subculture. And it talks about traditional cultural beliefs of Navajo Native Americans. So just to remind you, the people living in this area, in this country before Christopher Columbus came, before the Europeans came in, the indigenous population, which we refer to as Native Americans, one of the nations is Navajo. And the Navajo Indian Reservation in Arizona, when they've done research into traditional values and ways of thinking, they have learned that in this culture, if you say something, the words have power. So if someone was about to have surgery and you warn them, oh, well, there are risks with this surgery, you might not wake up. Well, now you've said it out loud. So now, because your words have power, it's going to happen. The person's going to die in surgery. So they talk about how the belief system where negative words have power, and if you speak negative words over someone, that means you've just created problems and now it's going to happen. So how do you match that with your responsibility to warn somebody about the risks of a surgery? So it goes through this type of cultural ethical dilemma. How talking in a negative way, they believe that's going to harm them. That's the Navajo belief system. So this is an interesting article about that ethical dilemma. So you're going to read through that. Okay, I shall stop here.